that the presentation itself is a purpose of sharing best practices. I think in a global corporation where you have diversity, it becomes a challenge at times, to come up with a good approach, because I guess one size doesn't fit all, and that's the intention of this presentation. So here we are. Let me just give you a brief outline. So let me speak briefly about what the benefits of the health promotion program would be, I guess, for the non-medical folks over here. The challenges that we have learned over the years of implementing wellness programs. The strategy that we think would be a good formula, speaking of the key elements of a health promotion program. And looking at the interventions, so we're going to share examples of interventions, looking at the different levels of prevention. And to be more concise about it, sharing IEC strategies, or information, education, and communication strategies. So I guess this is not something that's new for everyone over here. What would be the benefits of the health promotion program? Of course, to the organization, it speaks of a well-managed health and safety program. It provides a positive and caring image for the company. It, of course, improves staff morale. Would like to believe that it reduces staff turnover, reduce absenteeism, therefore increase productivity, reduce health care and insurance costs, which I think is one of the ROI that Dr. Moen was speaking of. Reduce fines and litigation, which is also important in a country setup where health promotion is very much a legal requirement. And I think I can speak of that for Europe, where my counterpart, Lars over here, is providing oversight. So to the employees, what does a health promotion program mean? That would mean that you will have a safe and healthy work environment that would enhance your self-esteem, reduce stress, of course, and improve your morale. Hopefully, it increases job satisfaction and increase skills for health protection, improve your overall health and the sense of well-being. So those are just, amongst the benefits of that. Now, we speak of the challenges when we do that. In the years of experience that I have been doing this and doing wellness programs and health promotion, we have to acknowledge that Sani mentioned earlier about population health. And there's a lot of socio-cultural determinants of health. So on the right-hand side of the slide, you will see that it speaks of those variabilities and the factors. So there's an importance of integration of the health data and the felt needs into the program design. What do I mean by that? I think it's different to see what the actual needs would be, and that's our role as the professionals, thinking what is best for our employees. But it might not necessarily resonate well with the employees because their felt needs might be different. So there needs to be a common ground in that. One of the other challenges that we have is the relevance of our communication to the recipient. So it has to be very concise. That's why I try to make my presentation brief, because I know that we have a limited attention span. So that becomes a challenge in itself. Monitoring and evaluation can often be neglected. We speak of metrics, but really following through would be something that we often miss out in a program. Of course, there would be gaps, and normally that is where the challenges of policy and funding support comes in. So what would we think would be a health promotion strategy that would be effective in our setup? So this is based on our experience in IBM. So addressing all levels of prevention, primary, secondary, and tertiary levels, and in the next few slides, I will be showing you examples of what we have done across Asia Pacific. It should be evidence-based and reflective of the geographies concerned. So there were 3 components that I would think would be important to have a good marriage and to come up with a good design. So that's looking at the country profile. The national health statistics would tell you, what would be the top concerns of the country. Of course, you'll have to also try to align that with the workforce profile. So that's where the periodic health checks would come, healthcare data. And for the last, I'm a great believer of focus group discussions. I think this is a very good and effective tool, which is very simple to carry out, that validates the actual needs versus felt needs. So that's what I'm talking about, because not necessarily we in our position would think that was a great idea, and not necessarily that employees would believe in that. One of the things that I had always advocate is to highly consider the interplay of the multiple factors, and therefore, I always tell this to my global leader, one size doesn't fit all. And we have seen that happening across the region. So at the global level, what does it mean? I think on our view, it should just be policy-driven, mainly providing guiding principles rather than a prescribed portfolio of programs. So it speaks about what would be the priority health issues of the organizations, what would be their concerns. We also have to look into employee engagement, knowing that health promotion program is an investment of so many years, and we're looking at behavior communication change. And of course, an important part of the design is stakeholder collaboration. And when I say stakeholder, it doesn't mean only our uplines, our executives, but also even down on the ground, the HR folks, even procurement in itself would play a big role, compensation and benefits. So we speak normally, and I know, and I talked about it during my panel session where we say that normally it's a challenge in the occupational health space where our organization, being very revenue-oriented, would look at ROI. But there's another perspective into health promotion where we speak of the VOI, or the value of investment. And I think that is where we're trying to bring this discussion where we speak of values through comparative cost analysis, the cost per morbidity averted. So for any illness that you avert, you speak about the comparison of how much would your program cost. And of course, the employee experience. So in IBM, where we're focused on doing the Net Promoter Score, which is one way of us looking at the value of whatever programs that we put in place. So the key elements I've mentioned, stakeholder consultation and collaboration, I think this is a very important part to have a sense of that ownership. So we've spoke about really safety being an individual also responsibility, and that's the same for our health and wellness. Cross-functional approach is the ideal thing that we should do, but within this we have to be cautious to provide a clear delineation of the roles and responsibilities of each, and to make sure that expectations are laid out. So alignment of wellness program is very important to the key business needs, because you're not going to be able to find funding support if you don't speak their language, and that's what I talk about. So we have found like the CSR component resonates well with the executives. They like that approach because it speaks of branding. They also like, when we relate the wellness program to a decrease in healthcare costs, because I think, in most companies, this can cost a lot, the same as workers' compensation and disability claims. So it's also important that when we do this approach, there should be executive awareness and support. I think looking at champions in the level of executives would be a great boost as well. Of course, we should not forget that in whatever design we look into providing a good employee experience, and therefore we could achieve employee engagement. One of the things that I think had been fairly missed out in normally when we do monitoring evaluation, which I think is a key here, is we often get satisfaction survey among the participants. But we have to think about the non-participants, and I think it's equally important to get feedback from the non-participants. It's a good way to learn, how do we improve, or how do we get that proportion of people that we have not been able to get to be interested in the program. So of course, we talk about strategic incentives. We don't be impunitive, about carrot and the stick. I think the wellness thing is really approaching it on a positive perspective. But like one speaker said earlier in the panel was that we should be careful about these incentives as well. So it doesn't have to be monetary in its form, but would have to be carefully thought on how it would provide a symbol or a meaning to whatever that has to be achieved. And of course, it's just not, we have to go beyond metrics. It's just not about the numbers, but looking at the well-designed analytics. So those are the key elements that we have seen. So I think this is more to concretely provide and share with you the best practices or experience that we have in IBM. We talk about primary level, where we prevent exposures to the hazards to prevent the cause of disease. So like, for example, in Singapore, I spoke about a CSR component. So we have an example in Singapore where we have the STEP challenge. So there was a pledge of 67,000 kilometer steps completed in 1 quarter, for which we had committed together with an organization to donate to identified homes a total of 670,000 bowls of rice. Similarly, we did a walkathon in India, where there was a step challenge with a twist using a mobile app, so it sort of works as a pedometer. And then the social component actually last year, 2016, supported 400 cataract surgeries. In the year before that, we supported girls' school children in India. So this was very overwhelming in terms of response. So we see that the CSR component really just doesn't resonate just with our executives, but employees as well. Then in China, we did an approach where they widely use this mobile app called WeChat. We know, for example, for a fact that in China, it's very limited in the way that they're able to do their social networking. Google's not allowed, so we had to innovate in a way to look what would work best for them. So we had done a lot of IEC media campaigns through the WeChat app. So again, in India, we were looking at flu vaccination program and increasing participation. So we did that across 7 cities span India. We did a lot of strategies, including mascots and mailers. In ANZ as well, we did the Smiling Mind. So this is looking about mental well-being. So there's an app that we use. So you see, we're very much on a mobile app because I think that's what the generation is about right nowadays. And so employees had really documented to report a reduction in perceived stress levels. In ASEAN, composed of 7 countries, we did a Commit to Healthy Tuesdays. So this is an ongoing 3-year program where we create a habit out of the employees by committing to a healthy action, which is being reminded through different means through every Tuesday. So on the secondary level, we show examples where we talk about mental health, stress management. We have a stress checkup that's done in Japan. This is driven by a legal regulatory requirement. And this actually had an accomplishment of over 80%. So this provides an early detection to high-risk individuals and provide counseling to them. Similarly, we did wellness advisor, Dr. Cruz in his technical session mentioned the EAP. So this is our program component where on top of EAP, we have medical support and wellness coaching as well. In fact, we had gained a lot of success in Korea that we had reported an 8.4% utilization, which is way over the industry rate of 3%. Similarly, in Korea, we had taken the opportunity where it's just not about compliance, talking about periodic health checks in countries where it is mandatory, but to make and provide an opportunity for high-value services. So we do relook at the requirements and do evidence-based examinations and recommend standards based on the age-appropriate group.